Caring for the sick and injured and promoting the health and wellness of everyone has been Marjorie Cole's mission since she became a school nurse in 1982. She called it Connecting the Dots. And to Marge, connecting the dots meant that all school children in Missouri deserved a school nurse just like her. Marjorie St. Clair was born in 1942 in North Carolina, where she attended elementary through high school. She then graduated as a registered nurse from the Watts Hospital School of Nursing in Durham, North Carolina in 1964. Her thought was that she could combine her love of education with teaching people to be healthy, and so the idea of becoming a school nurse was born. Her plan was put on hold a few years, however, when she met and married her husband Richard in 1968. They moved to St. Louis in 1973 so that he could work as an engineer for McDonnell Douglas. Marge's early experience in nursing was in clinical research and then pediatric emergency care. Marge and Richard have two children, Catherine and Stephen, who were born in 1973 and 1974. They are both graduates of the Parkway School District. Marge was a stay-at-home mom during their elementary school years. Stay-at-home really meant being a room mother, PTO president, fun fair chair, and more. In 1982, Marge began work as a school nurse in the St. Louis County Special School District. She was hooked. School nursing was the total package. She worked for the sick and injured while promoting the health and wellness of everyone. Marge introduced programs such as Scrubby Bear to teach children to wash their hands properly. She worked with students who had AIDS, and she held informational meetings for staff regarding precautionary measures. She worked with all students from early childhood to vocational technical high school students. Marge became involved with many nursing organizations, and from 1989 through 1992, she was the legislative co-chair of the Missouri Association of School Nurses. She then became president of that organization in 1993. Marge joined several other community organizations advocating for children's health, including the Archbishop's Commission on Community Health, the Maternal and Child Health Advisory Committee, the Vietnamese Free Clinic, the March of Dimes, and the Cancer Society. In 1994, they all lobbied for HB 564 to fund school health services in school districts without health services. Nearly 50% of the districts at that time did not yet have a school nurse. Also in 1994, in addition to completing her bachelor's degree in nursing from Missouri Baptist University in St. Louis, she became the health services facilitator at St. Louis County Special School District. There, she administered a grant to expand the role of the school nurse to caseworker, and in 1995, she became the Administrator of Health Services. During that time, she supervised the entire school health services program, worked with state and local agencies to positively affect the health and welfare of students and their families, and organized many programs to help with poverty, community resources, and special needs. Marge redefined what a school nurse does. Every school day, she was dealing with colds, flu, headache, diabetes, asthma, seizures, depression, hunger, and pregnancy. Marge would help the students and train others to help them too. In 1999, Marge received her Master's of Science in Nursing from the University of Missouri St. Louis. She was awarded the Excellence in College Leadership Award and elected to membership in the Chi chapter of the Sigma Theta Tau International Nursing Honor Society. From 1999 through 2001, Marge was a consultant with the Community Health Nurse Program at the Missouri Department of Health and Senior Services. Then, in 2002, she became the manager of the school health programs and state school nurse consultant. Her work promoting health and wellness has never stopped, presenting at state and national conferences, training school nurses to work with the 80,000 students in the state who have asthma, collaborating across agencies to address the mental health needs of children, providing workshops for new school nurses, working with a national think tank of school nurses about standardizing school health data. The list of her accomplishments and awards is staggering. Additionally, Marge encourages school nurses to apply to be part of national programs. Because of this, Missouri has 5 school districts that participated in the highly competitive Johnson & Johnson School Health Fellowship Program. All 5 districts, McDonald County, Neosho, Carl Junction, Seneca, and Mexico, earned the distinction of Johnson & Johnson Fellow in School Health. Marge has implemented many programs, procedures, and set the standard for school health policies. She has addressed the Centers for Disease Control and received grants from that agency. They, in turn, have used Marge's information for social media campaigns to share with the country what a healthy school looks like. Marge and Richard like to spend time with their two wonderful grandchildren, Alejandra and Tomas, always making time for an annual trip to Disney. Marjorie Cole's work with school nurses is unprecedented. She has created a culture of trust with nurses across Missouri. At one time, students were sent home, but now, more often than not, they are sent back to class after seeing the school nurse, especially when that nurse is just like Marge. She is a pioneer.